quick introduction to the healthcare system. I don't think you will ever see this again, but back in the 1790s, World War I, you got some things in here. The Civil War was a horrible time for medicine. You know, they died of staph infections and all these infections. They didn't know really what to call them. But, you know, that they didn't even use gloves back then. They went from, I'm going to cut your leg off, and with my bloody hands, I'm going to come over here and cut your leg off. Right? Because they did a lot of amputations. So they cross-contaminated patients. Patients died of these horrible infections that they later found out was some type of staph infection. During the Korean and Vietnam War, the MASH type units. Have y'all watched the show MASH? I think it's a comedy, sort of older, way older comedy. Nobody's watched MASH? Yeah. I was going to say, you're missing out. It's one of the longest comedies that's ever been, sitcoms that's ever been on TV. But it started this sort of a EMS type program there where they started transporting patients in helicopters and ambulances there. And then it just sort of evolved out from that in there. That's like the guy's fixing to get his leg cut off because they don't know anything about medicine. And then sort of early 1900s, they started operating ambulances sort of to go and pick people up. The problem is they didn't have any requirements. The early ambulance services were actually owned by the funeral home, and the people would race to the call. They didn't really care about helping the person. They just wanted the body. In case they died, they were already in their hearse, so they just took them to their funeral home, literally. So and then they picked them up. They put them on a bed and they put them in the back of this old station wagon looking thing, but there's no attendant in the back. There's nobody taking care of them back there. So they were bleeding out in the back of this, and if they got to the hospital and they were already dead, then they just took them to the funeral home, their funeral home. It has changed drastically since then. Like it says here in the 60s, they started developing, the Department of Transportation got involved and set EMS standards. The National Registry founded in the early 70s. So that helped out to standardize some testing things. And then in the mid-70s, the National Emergency Medical Service System Act. Not even sure what that is. I wouldn't be overly concerned. I would just be familiar with it. It's not something you have to memorize. You just need to be familiar with it. As EMS progressed, then you got more regulation, more policies, more good management, coordination between fire departments and EMS agencies. And then you get into more training. As you see the progression in this, you see more training, more training, more training, more education, more people sort of getting on board with it. Start sort of establishing minimum qualifications. That's what you guys are doing right now. You're sort of meeting these minimum qualifications, and then providing better transports. You'll see sort of the evolution between the ambulances from something that looks like a funeral home type of vehicle to something that resembles what an ambulance now, right? So that's all got better. The facilities got more used to having EMS, paramedics, EMTs taking care of people pre-hospital. When it first started out, not so much. They didn't like that. The doctors didn't like it. The nurses didn't like it. But it's all gotten better, much better. And then now, we're to the point of this 911 system. You guys were born into the 911 system. You don't know anything different, right? And now they have this enhanced 911 system. And now even with the cell phones, they have this process where you can, when you call on the cell phone, they can locate the cell phone. So everything is evolving much more. They get different trauma systems, different protocols, different hospitals. they set up a program to evaluate QI, quality instruction and assurance. When you work in any kind of medicine, whether it's pre-hospital medicine, you work in the hospital, you will always have someone looking over you to make sure that you're doing what you're supposed to. I did QA, QI for a while. Nobody likes that. Nobody likes to be looked at under a microscope, but it's very important that you do so to make sure that everybody's doing what they're supposed to be doing. Without that, then you just don't have any consistency in your training or education. Then the more that the public got aware of the things that go on, the more that they get involved in. I mean, you guys know now the 911 system is everybody from little kindergarten kids know about 911. And then medical direction. You have a medical director. I need to get his name out. It's a strange name, but I need to tell you who your medical director is. That's how you guys operate. I have a medical director. So he allows me to practice under his license as well. So when we look at this, we look at the doctors, the nurses, all the other people that work in the hospital. They compose part of the 911 system. And then you have these specialty centers. You have the trauma center like Parkland and Baylor. Burn Center around here is Parkland, right? The Children's Hospital, the stroke centers, the cardiac centers. Now they're doing, they have a stroke protocol and a heart protocol out, where if the patient's having a stroke, you take them to a certain hospital. If they're having a heart attack, you want to take them to a certain hospital. That way it improves their care. Labor and delivery. So if you were in this area and you were doing EMS, then you would know not to take anybody that's in active labor to Dallas Regional, right? They don't have an L&D. So you have to start making these different choices in the different components. This tells you sort of a step process with it. Obviously starts with the patient. This is sort of weird timing. That was my son on the phone. He just got in a car wreck. So starts with the patient. They call 911. It goes to the dispatch center. There they dispatch the fire departments and the EMS. EMS gets on scene, packages and stabilizes the patient, takes him to the emergency department, and then other allied health like radiology, the lab comes in. All the other departments come in and take care of them once they're at the hospital. So it's a complete chain that we have. Without one of these systems in here, then we wouldn't be able to operate the way that we do today. We know that 911 is in just almost every area. They enhance 911 where when you call 911, it shows, like if you call from your house, it will show your address. They're still asking for your address, but it'll show up in their 911 screen. And then cell phones. They're starting to be able to track the cell phones now. Much better than what they were. This is something that you might be interested in doing as well. It's a job that you'll be available for. You have to take a little extra training, but you can become a 911 dispatcher. And they will train you in the EMD stands for Emergency Medical Dispatcher. It's just a short 3 or 4 day course that you would take, and you could become a dispatcher. They like all the EMDs to be EMTs. So that way you have an advantage. You go in, you have your EMT, then you could go somewhere and take a EMD class. You can actually take one online. Or you can apply for at one of the departments, and they may send you somewhere to go to the EMD class. All about EMS is, and what we lead up to, is making good, timely, critical decisions, being able to think through a process from the start of patient care to definitive care. Even before we make patient contact, part of that process is going through and thinking about the call and sizing the call up. Remember I told you guys always to think worst to least? So worst case scenario to least case scenario. That way when you get on the call, you're able to you're able to think through that process. You won't have to revert back. If you think least to worst, then you're going to get there, and if it's a lot worse, then you have to work your way back. If it's a lot less call, say you go on a chest pain call and you're thinking cardiac arrest, I got to prepare for cardiac arrest, and you get there and this guy has gas, then it's much easier to deal with that than think back and get prepared to do CPR on somebody. So here's the level of trainings. Now these are very important. You'll see these on most all of the exams. The emergency medical responder, or the first responder, is essentially, I would say pretty much what the Horn students went up to last year. They could almost be medical first responders. You had the knowledge and skills for the most part. The EMT is where you guys are now. The EMT basic. They have an advanced EMT that we don't train, but used to be called the intermediate. Here what the advanced EMT does is start IVs and does intubation. We just don't do it with this program. It's not really worth it. And then paramedic. So these are the different levels of training. At this line, this advanced EMT, you get into advanced life support. IVs and intubation is considered advanced life support. The paramedic level does all these, except then does cardiac rhythm interpretation, advanced airway procedures, and all the medications. So there's quite a bit of difference. In school, it's about 1.5 years, I would think, from here to here is about 1.5 years of school. So from EMT to paramedic is essentially another 1.5 years, plus a lot of clinical hours. 300 or 400 hours of clinical. So when we look at, when we start out and we get going in this EMT stuff, we have to remember that safety, your safety is number one, always. I say that over and over again. Your safety is number one. How it ranks on the scale is my safety, my partner's safety, the patient, then the equipment. So the patient comes just right before the equipment. So your safety is always the first. Make sure that you're able to do a good assessment, lifting and moving, the transportation phase of the process, the transfer of care from where you have care to the hospital, and then you're out to be the patient's friend. You want to educate and train the public in this whole process. 85% of all 911 calls don't necessitate an ambulance. So 85% of the people that pick up the phone and dial 911, they shouldn't be dialing 911. They don't need an ambulance. Most of them need to go to Walmart and just learn basic health care, basic first aid. The other large percentage, they probably need to go to the doctor, not necessarily the emergency room, but they should get in their cars and go in their cars. Only about 15% of all 911 calls necessitate an ambulance. When you break that down, 10% is medical and 5% is trauma. And then when you break the trauma down, you get about 2.5% is major trauma. And we'll define that as we go through. We'll say this is major trauma. So you've got to lift and move. Eyesight's handy. I mean, even with my old eyes, I have to be able to read and look ahead and see good. You have to be able to communicate here, because good communication skills, you're communicating with the patient's family, so you have to calmly speak with them, but you're also having to communicate with the doctors and nurses. So you're communicating over here in layman's terms to the family, and you're communicating over here in medical terms to the doctor. So you have to be a good communicator. Oops. And you will always be going to school. We mentioned this before. No matter what profession you go into as far as healthcare, you will always be going to school. You want to maintain good knowledge and skills up to date on stuff. I mean, besides I like what I do, that's one of the reasons I still like to work on the ambulance. You keep updated with the knowledge and skills of what's taking place. You read the different magazines, and you will always have continuing education. I think the CE for 4 years for the EMT is 40 hours of CE, continuing education. And just a side note, once you get your EMT certification, don't let it lapse because you didn't do CE. You never have to retake the registry test again. You just have to keep current on your continuing education. It's not worth letting that lapse. And you think, well, I'll never use this. I've trained a lot of RNs through EMT classes because they want to go fly. They want to go fly on a helicopter, and you have to be a paramedic. And the first step is what you guys are doing, is the EMT. So once you get it, hang on to it. All you have to do is a minimum amount of CE to keep up. The EMS conference is one way that you get CE. You go and you get the CE. I've got to look up, see how many hours it is. A lot of job opportunities, we've already talked about that. You can work on the ambulance, the fire departments, the ERs, the event medicine when you go out and you work in concerts. Anywhere where there's a large body of people, there's usually EMS. Like this Friday, I'm going out and sitting at a football game and watching some football. I'm getting paid to do it. Right? That's a good time. Last year I went to a lot of Horns football games because my son was there, but I worked on the ambulance, made a good amount of money watching football. Sometimes you got to work, but it's a good thing. So there's always jobs. There's tons of jobs. If you go out and you research EMT jobs right now, if you Google that EMT jobs in Dallas-Fort Worth, there'll be tons of things pop up. The average salary around this area is between $12 and $14 an hour. And you would make more in the hospital if you worked in the hospital. So a lot of different things. Even industrial settings, not that you guys want to do that, but one of my first jobs in the EMS, I worked at a copper refinery. So even something like that. And then the National Registry of EMTs is just the way that we certify. It's a horrible test. I hate the National Registry, but it's a standardized test that everybody takes. The good thing with you guys is that anywhere that you go in the United States, you can have your National Registry, and so you could work anywhere in the United States. So if you moved out to California, you would work in California. You would have to apply for their state license the same way that you would in Texas, but you can work in California. You work anywhere in the United States. It's called reciprocity. They give you reciprocity until you're able to get their state certification. So in college, it doesn't matter. College is another place. Work on the campus. Some of the bigger colleges have EMS on their campus that's run by students. That's something to look at. A&M does. The whole EMS system is about quality improvement. You always want to try to improve what you're doing. You look at the system and keep trying to improve it, improve what you do, improve patient care. Good documentation. I can't overemphasize good documentation. We have a whole class on it. That you guys want to document very well in your reports. Everything that you write down, even on your clinicals, is a legal document. It can be subpoenaed and be entered into court. When you get out and you start working as EMTs, that can be subpoenaed. It's a legal document. So misspellings, poor grammar, all that in the documentation, if you ever have to go to court with that, they're going to make you look very foolish. and you'll probably lose the court case over it. So when we look at how the system is set up, we look at our medical direction, because you have to, in order to practice medicine, you have to have a medical license. So the way that the EMS system works is that you work under a medical director. So my medical director allows me to perform the knowledge and skills that I have under his medical license. If I do anything outside what he allows, then I'm considered practicing medicine without a license. So he is ultimately responsible for the EMS system. He oversees the training, develops the treatment, the protocols. We'll look at a set of protocols here after a bit. Has an offline medical control, which just gives you standing orders. What a standing order is an order, a medical order, that you can do without contacting the medical director. Now this is very important as far as your testing and here is concerned, is that you don't have any standing orders. Everything that you do, you have to ask medical direction. You'll see that in the test questions as they start coming up. Request medical control for blah, blah, blah. So, but standing orders are orders that you can do without physically contacting the medical director. The online medical control is just like it says, if I need to call, if I have a question or concern or an order that I need to give this drug and I don't have a standing order for it, I call my medical director on the phone, usually, or the radio, and he will give me permission to do it. So online medical control is where you physically call the doctor, and the doctor gives you permission to give a medicine or to assist with that nitro, or assist with the EpiPen in your case. Is everybody good? Any questions?
So every time you want to administer medicine, you have to call the doctor?
Yes. Now you get to working, and they set up protocols. Like if you come out of here and you go to work for ABC Ambulance Company, they may have a set of protocols with standing orders allowing you to do so much stuff without contacting the doctor. But if it's not listed in there, then it will, you'll have to contact the doctor. It'll clear everything up once I show you a set of protocols. I'll show you the difference on there. Research is always important. You know, in Texas they have a thing called the RAC, the trauma RAC, and it's a group of people that get together, nurses, doctors, EMS workers, they get together. They track certain causes. They always track childhood fatalities. They track all the big major trauma. That way, they can research into this and find ways to reduce that, essentially. All right?